Hi, my name is Kayla Manning. My student ID is 3045193. I am appealing the NFDN 1002 CIA, and my section is X06 with Beth Archibald and Stephen Wong. And this is my student ID. You can come do a 360 of my work area. This is my med admin cart, my patient, and then my documentation area. Okay, so we can come out, begin skills assessment. So the first thing I would do is check for any PPE precautions on the door. I don't see anything, and then I'm going to sign in my signature log. So this is for Tom Ford. That is the patient I'm seeing today. Good. I would sign my name. Okay, perfect. Signed. I'm going to enter. And first thing I'll do is sanitize my hands on entry. And then I'm going to approach patient's bedside. I'm going to provide privacy. And I am going to raise the bed to working height, lower the side rail, and introduce myself to the patient. So hi, my name's Kayla. I'm going to be your student nurse today. Do you mind if I have a look at your ID band just to verify your identification?
Yep.
Okay, perfect. Can you repeat your full name to me?
Tom Ford.
And your date of birth?
February 18th, 1997.
Perfect, so that checks out. I'm just going to ask you some questions to assess your level of orientation. Do you know where you are today?
I'm in the hospital.
Do you know what time of day it is today? This could be morning, afternoon, evening.
It is the morning.
Perfect. Do you remember my name?
Kayla.
Okay, great. So my patient is oriented to person, place, time, and situation. Now, I see you have an allergy band for penicillin, so you're allergic to penicillin?
Yes.
What happens?
I got a rash.
Okay, are you allergic to anything else that you're aware of? This could be to latex, drugs, environment, food.
Not to my knowledge.
Okay, perfect. I'm just gonna write this down. No other allergies and penicillin. So, I hear you're in some pain today. Can you tell me a little bit about what happened?
So I got stung on my left forearm about 30 minutes ago.
So, stung on a forearm, and it happened 30 minutes ago.
It's a bit of a...
So, can you describe how this pain feels? Is it throbbing, aching, stinging?
It's a stinging sensation.
Stinging pain. Is there anything that makes it better or worse?
I think maybe Benadryl or Bactroban would make it better.
Benadryl or Bactroban might make it better. On a scale of 0 to 10, 0 being the least pain you've ever felt and 10 being the most, where would you rate your pain?
I'd say it's a 2 out of 10.
Okay, so 2 out of 10. And you think the sting is causing your pain?
Yes, it's not radiating, I think it's the sting.
Okay, have you had a sting before?
Yes.
Okay. And on a scale of 0 to 10, what would you like your pain to be?
A 0.
0 to 10. Okay, perfect. Is there anything else you'd like to tell me about your sting today?
No, I think that's everything.
Everything? Okay, perfect. Now I'm just going to take your vitals. So first thing I would do is take his blood pressure. What is that value?
130/80.
130/80. Then I would take his pulse and respiration rate. What are those?
Respiratory rate is 18 breaths per minute, non-labored and deep. And pulse was 98 beats per minute. Apical equal to radial, regular and strong.
Okay. Strong. Regular, deep. And then I would take his oxygen saturation. What is that value?
98% on RA.
Okay. 98% room air. And then I would take his temperature,
which is 37.3 degrees Celsius oral.
Okay, so everything's looking normal. His respirations are a little higher, but not out of ordinary. Okay, so I'm going to have a look at what the doctor's ordered for your pain today. I'm going to have to just leave the room and check the med admin cart. I'm going to lower your bed, raise the side rails, and give you this call bell. If you need me, please press it. I'll give you this remote to entertain yourself. I'll be right back with you. So then I'm going to exit the room, sanitize my hands before I leave. And I'm going to go to the med admin room. So now I'm at the med admin cart. I am going to have a look at the physician's orders and the allergies. So I'm going to check his allergies first. This is for Tom Ford. Penicillin, he gets a rash. That checks out. Good. the lab values. Not too concerned about that. I'm going to take a look at the physician's orders. This is for Tom Ford. Vital signs every shift and when needed. So we did that. Benadryl liquid, 25 milligrams oral every 4 hours as per needed for his allergic response. And Bactroban 2% ointment, topical, 3 times per day as per needed. Apply to affected area and leave to open air. I'm going to take a look against the MAR. So I'm comparing these two. Tom Ford, same patient. Perfect. Month and the year, it is February 2021. Nothing has been administered yet. It is 7 a.m. so we're going to do his first dose. He's requested the medication. So the first thing I'm going to do is do my 5 med and min rights while taking out the medications. So I will start with Bactroban. So this is for Tom Ford. That's my patient. Checked against the MAR. The medication is Bactroban, 2%. The route is going to be transdermal or topical. The dose is going to be just like a dollop, 3 times daily as per needed. And the expiry date, 2028, so it's not expired. Good. And also withdraw the Benadryl. So normally Benadryl would probably be a cough syrup. I don't have a cough syrup, so I'm going to just use a vial and take the medication out with a syringe. So this is for Tom Ford. The medication is Benadryl. He has been ordered 25 milligrams. This is contained in a 25 milligram per 1 ml vial, so I'll be taking out 1 ml today. The route will be oral, and dose is 25 milligrams, and the expiry date is 2022. Not expired. That's good. That's my first check for both medications. So before I do my second check, I'm just going to get my medications ready. So Bactroban is already pretty much ready. It's in the tube, but I have to get my Benadryl, so I'm going to sanitize the top. Aseptic technique. I'm going to find an appropriate syringe. I need a 1 ml. I'm going to get a blunt needle to withdraw the fluid, and I am going to uncap. I am going to invert. Actually, I'm going to pull up on the needle so I get 1 ml of air. Good. And I'm going to inject the air into the air bubble so I get a vacuum seal. Then I'm going to invert, and without touching the plunger, I'm going to pull the liquid I need out. Try to get rid of the darned air bubbles. Good. I've got my 1 ml here. Ooh, sorry, I should have inverted that. It sprayed a little bit. And I'm going to do a safe recap here with the needle. It's 1 ml. And then I'm going to label it. So I'm going to put my 5 rights here on the label. This is Benadryl for Mr. Ford. It is 25 micrograms and 1 ml. And I'm gonna put this on the tip. I'm also gonna write the expiry, 2022. Fabulous. And I'm putting that on the needle tip. Actually, I'm gonna take the needle tip off because I'm gonna put this in a cup. It's oral. So they're going to just be drinking it down. So we can remove that. I'm just gonna inject the fluid in this cup. So this is 25 micrograms of the medication. This can go in the sharps bin, as can this. This will go in the garbage, and I'll do my second check against the vial. So this is for Tom Ford, good. This is Benadryl, that is the drug, good. This is going to be every 4 hours as per needed. This will be his first dose. This will be oral, and the expiry date is 2022, so we're good there. I'm gonna also check the Bactroban. So this is for Tom Ford, good. We have Bactroban 2%, good, that was a match. The route will be topical. Dose will be $1 3 times daily as per needed. Expiry date 2028, good. So that's my second check. I'm gonna treat this as my little med tray. So I'm gonna have my meds on here. I don't need this, I need this. This can go back into the drawer now, and before I do that, I'm gonna do my third check. So this is Benadryl for Tom Ford, so patient, medication, route will be oral, dose is 25 milligrams, and the route, and the right patient, route, dose, and expiration date is 2022. Good. So we've done our 5 checks. That is my final check for that one. My final check for Bactroban. So this is for Tom Ford. The medication's Bactroban. Good. We are giving him 1 dollop. That is the dose. The route will be topical, and the expiry is 2028. So we're good there. That is my 3rd check for Bactroban. I'm going to bring this with me. I'm also going to get some water so he can orally take this medication. And I'll put this label on the medication cup. Benadryl for Mr. Ford. So now I've done my 3 checks. I can go back to the patient's room. I'm gonna sanitize here. I'm coming back into the patient's room. I've sanitized. I'm gonna bring this to the patient's bedside. Just trying to collect myself. There we go. All right. So come in, I'm going to provide privacy again. I'm going to raise the bed, lower the side rail. I'm going to do my 4th check now on his ID band. Do you mind if I have a look at your ID band one more time?
Yep.
And can you repeat your full name to me and your date of birth?
Tom Ford, February 18th, 1997.
Okay, fantastic. So I've got your medication here today. The doctor has ordered you to have Benadryl and Bactroban. I'm not sure if you're familiar with these medications, but I'm going to give you some education on both of them. So Benadryl, or diphenhydramine, is for the relief of your allergy symptoms you're feeling, so all that itching, redness, and discomfort on your arm. We'll be giving you 25 micrograms today in a cup. You'll be taking this orally, so swallowing it. It'll take about 15 to 60 minutes to set in, then you'll feel the effects for about 2 to 4 hours. Some adverse reactions you may feel is drowsiness, dizziness, a headache, your mouth and mucous membranes may be dry. You may have blurry vision, so I don't recommend driving or moving around too much while you're on this medication. Some interactions. So are you taking any other antihistamines, drinking alcohol, on any opioid analgesics, or MAOIs?
No.
Okay, perfect. So there will be no interactions. Are you taking any natural herbal supplements like kava, valerian, or chamomile?
No.
Okay, this will just intensify the effects. That's great. I'll also educate you about Bactroban. So this is a topical medication. It is an ointment. It is a treatment of superficial skin lesions. So that bump you have from the sting. Safe dose is 3 to 5 times daily, just 1 dollop. So we're just going to give you a little dollop on there. Some adverse reactions you may feel is burning, itching, pain, or stinging. This will go away. If it doesn't, I need you to notify me. There are no serious interactions with any other medications, which is good. Is there any reason why you'd wish to not take these medications today?
No, I think we'd better go ahead with it.
Okay, fantastic. So I would get some water and a cloth and some soap, and I'm going to wipe the site here. So I'm just going to do a couple passes. I'm going to be really gentle because he's got an injury there. And I'm going to apply the Bactroban. So I'm going to do my last 5 rights here. So giving you Bactroban, 1 dollop. This is going to be topical. And I'm going to give this to you 3 times daily as per needed. So whenever you need it, this will be your first dose. So we're going to do, I'd have gloves, glove up, get a dollop, and spread that over the site of the wound, being very gentle. So we've got that over the site there. So inflammation should be going down shortly. I'm also going to give you your Benadryl. It is in liquid form. Can you do a dry swallow for me just to make sure you can swallow?
Yes, ma'am.
Gulp. So there's a dry swallow. That's good. I'm going to give them this medication now so they can drink that back. Do you need assistance doing this?
No.
Okay, so he's just going to do it himself. And he's going to drink that down with water. Make sure to finish all the water. Okay, fantastic. So now I've administered both medications. So I'm going to be back in about a half an hour to check on you just to see if there's any adverse reactions or if you're feeling any better. If you are feeling any of those adverse reactions I listed, please press the call bell. We can come running. So I'm going to lower your bed, raise the side rails for your safety. I'm going to give you the call bell here. Press that if you need me, and I'll be right back. So I'm going to take my cart of garbage and stuff, and I'm going to leave the room to do documentation. So I would provide privacy again, bring this back to the med room, and then I'm going to fill out the MAR and the PRN. So, before leaving, I would sanitize one more time. Now I'm back in the med admin room, so I'm going to fill out all my documentation that I need to do. So, the MAR I administered on 2020 Feb 25th, 2021. The Benadryl, so today's the 25th. So I'm going to initial on the 25th. This is first dose of the day. Bactroban, also did today, Feb 2021. And I'm going to initial over here on the 25th. So med admin record done. Now I'm going to do the PRN. So medication, it's Benadryl, Bactroban. My Benadryl, I gave him 25 milligrams in the form of 1 ml. And this is oral. The date is 25th of Feb 2021. The time I administered, 7:15 a.m. Reason, allergic reaction and symptoms. We'll do the result after, so I'm going to initial there. We did Bactroban, we did 1 dollop. Transdermal, this is 25th of February. Time we administered, also 7:15. Reason, superficial skin lesion. And we'll do result after I come back in. So this is when I do the rest of my documentation. This will take about a half an hour. So I'm gonna come back now. I enter the patient's room. I'm gonna sanitize one more time. Take my stuff with me. I'm going to provide privacy again. I'm going to raise the bed to working height, lower the side rail. Hi, Mr. Ford, how are you doing?
I'm good.
So I'm just going to have a little assessment of your injury. So it looks like the inflammation has gone down a bit. Redness is down. You're not feeling any shortness of breath?
No. Yeah, I feel good.
Fantastic. And let's ask about your pain now. So are you feeling any resolution of the pain you were feeling?
Yeah, I would say it feels a lot less itchy.
So pain down, less itchy. Perfect. So education-wise, I'm just going to tell you in the future, try to avoid any bees or wasps, and carry Benadryl on your person, just in case you have any flare-ups or other reactions. Know that you should only take it once every 4 hours, and not to do any driving or moving around while you're taking it. Do you have any other questions for me?
No, I think that's good.
Okay, perfect. I'm just going to take your vitals again, just to make sure everything is working out. So I'm going to take your blood pressure.
125/88.
25, so it's down, good. I'll take your pulse and respirations.
My respiratory rate is 16 breaths per minute, non-labored and deep.
16, yeah. Non-labored and deep.
And my pulse was 80 beats per minute. Apical equal to radial, regular and strong.
Regular and strong. I would ask for the 2 descriptors, but you gave them to me. Thank you very much. Regular and strong, and I'm also going to take temperature and oxygen saturation.
My temperature was 37.1 degrees Celsius oral, and oxygen saturation was 98% on RA.
98% room air. Okay, perfect. So things look like they've resolved. If you feel any other adverse reactions or need any help, please press this call bell. So I'll give this back to you. I'm gonna lower the bed, raise the side rails for your safety, give you the remote so you can entertain yourself. I'll be back to check on you periodically. So I'm gonna take my stuff. I am going to leave the patient, ensure privacy, and sanitize my hands on exit. and skills section. So now I'm going to move on to documentation, so I can take the phone from here. Thank you very much, assistant. And we'll start my documentation. Just going to adjust this so that you can see. Begin documentation. Direction of practice. Client care record.